Good afternoon. Thank you so much for joining us this afternoon. My name is Alyssa Scarciotti. I'm the Client Education Specialist here at Lexir Dental Lab Group. It's my pleasure to introduce Tori McCraw. She's our Senior Manager of iOS Integration here at Lexir. So Tori is our resident expert of all things scanning and digital here at the lab. So Tori is going to be going over some training with you guys today. Just a couple little housekeeping things. If you do have questions, please feel free. We have a relatively small group, so please feel free to enter them in the chat, and Tori will try to address them either throughout the presentation or we'll certainly address any questions at the end. And then in regards to your credits, I will be sending out credits post-course. Usually, we like to say up to 2 weeks, probably sooner, but you can expect to receive your CE certificates from me within 2 weeks. So without further ado, I'll kick it over to Tori.
Thank you, Alyssa. Good afternoon, everyone. Thanks so much for joining us today. Yes, as Alyssa mentioned, I do manage and head up all of our digital programs as well as training programs here at Lexir Dental Laboratory Group. So today we are going to be specifically focusing on the restorative workflows, scanning with iTero. So we're looking at crown and bridge workflows and just the specifics, some tips and tricks, things to help you have better quality crown scans. And things that we need from a lab perspective as well too. So we'll go ahead and dive in. And yes, as she said, we do have a smaller forum today. So if anybody has any questions, you can see the chat. So if your question is relevant to the slide or when we get to the live scanning, I will try to pause and answer that right at the time so that it makes sense as we're doing it in real time. But for today, we're going to be covering an agenda. So part of the presentation that I have for you guys is via PowerPoint, but then I will be hopping over into my iTero scanner and doing some live scanning on a Typodont. But the first thing we're going to cover is the Lexir Scan Rating Matrix. And this is when we talk about restorative scanning because Lexir has a program where we can rate your scans. It is specific to iTero, so I'll get into that. Then we're going to go through preparation for scanning, some tips for restorative scanning. I do want to hit on the scan settings and a few things with the new iTero RX when it comes to restorative charting. And then we're going to do a live scan, and then we're going to get back into the PowerPoint that I have for you guys with some pictures and images of here. But really quick, I did want to just pull up a slide that just highlights a few things. And I'm sorry, guys, I got to move you around because it's right in the middle of my screen. A few points, data points that I found interesting. The first one being size is estimated to grow by 915 million at a compounded annual growth rate of 11.68% between 2023 and 2028. So have this technology obviously in your office, and that's why you're joining today. If you do, great, you're on the forefront of technology. But again, this is only continuing to grow, and adopting the technology is a great way to just go ahead and get ahead of the curve and know the technology and have a better patient experience overall. And that's what's most important at the end of the day is your patients. But I found that interesting. And if you guys want more information, we can certainly send you this link. We'll have an email that goes out just with some follow-up, and I in there as well too. It's really great data. But another point I wanted you guys to know is Lexir Dental Lab is direct to lab with iTero. So what direct to lab means is we receive your iTero scans within about 10 to 15 minutes of you sending that scan. Once we receive it, it is in our lab iTero portal. From there, we review the scan. If everything's great, we'll download it and put it into production. Obviously, again, if the scan's good and all the RX information is present. If not, then that's where the process of putting the scan on hold comes in place. And then we'll be reaching out to you and your staff to try to collect all the information we need to move forward with that case. But interesting fact, again, direct to lab, we get that scan quickly. We do bypass iTero's Costa Rica process. So they do have a team in Costa Rica that they receive the scans, they clean up your scans, and then they push them back to the lab for production. We bypass that. So it actually saves you some time, with a digital scanner by sending it to a lab that is direct to lab, in which all of our Lexir dental laboratories are to lab. The next point is Lexir has one of the largest training teams in the dental industry. So we have about over 60 employees who are iTero certified. And what that means is that iTero created a program. The program is called Calibrate. And this program was dedicated to training labs and educating labs on all of the workflows and how to use the scanner so that we can best support our digital customers. So again, with 60 plus employees, we certainly are prepared to support each and every one of you along your digital journey. And then the next thing, as I mentioned on the agenda, we are going to dive into the scan ratings on the next slide. But I do just want to highlight that this is only for restorative scans at this time. And it's also for iTero only at this time. Now, this is expected to grow. So if anyone's on here utilizing a different platform, hopefully we'll have the ratings for other platforms in the future. But at this time, it's only iTero. So diving into the scan quality evaluations, again, we'll send this flyer to whoever joined today in a follow-up email. But when I talk about rating your scans, this is the matrix that we have developed and that we follow here at Lexir. So when you send a restorative scan over to us, whether that be crown or bridge, we run it through this process of grading your scan. So we've got 4 categories, as you guys can see here. The first category is a perfect scan. Next is a good scan, third is a manageable scan, and then that 4th category is a rescan required. Obviously, your perfect scan, we're making sure we can see 100% of the visible margin and that there's no contamination or blood or missing data on the prep. That's obviously important to a lab as we move forward in fabricating any restorations. Good scan is we categorize this if there's 30% of the visible margin covered up with gingiva, contamination, or you have missing data on that prep. And then, of course, as you continue to go down the scale, manageable, it's more than 30% covered. Rescan required is complete. The margin is not visible, and we're going to need to push this back to you and have you rescan the patient. And because we are direct the lab, we do have the ability to push that scan right back to our customers. And what that means is that you will see that scan appear back in your iTero under your in progress scans, and the status of the scan will say returned in red. So make sure you're checking that in progress folder and making sure that you see, if you see anything returned, we want to pay attention to it. That means the lab has sent it back, and it will have some comments on it as well. So moving along, I do have some scans that I will be showing you guys at the end of the presentation today that fall within these categories. So you can see these were actual scans that were sent to the lab, and you can see why we graded them the way we did. But moving along for preparation for scanning, it's extremely important that you have your operatory set up for a good scanning experience. And what that means is that obviously for the patient, you want them to feel comfortable having them laying supine in the chair, you sitting directly behind them, and using your dominant hand as to scan. Now, the other thing that's important is you need to be comfortable as well too. So your arms need to be rested by your side to avoid any fatigue during scanning. And that scanner needs to be placed at a 12 o'clock position, slightly in front of you, so that you are able to see the screen and you're not having to stretch your neck or turn to the side, things like that. You can see the screen directly as you are scanning in the patient's mouth. The other really important is obviously the number 1 bullet on this slide, but you do really want to make sure you don't have any overhead lighting while you're scanning. This is probably one of the biggest things I run into when I'm in office training or speaking to customers. What I find is that they don't often realize that if you have any overhead lighting shining down in the patient's mouth while you're scanning, so this does include doctor loop lights, you really want to make sure those are turned off. You don't need anything additional. The scanner has enough in the wand to produce, it has enough lighting. Everything in there is good enough to produce the scan it needs to, so you don't need to add anything additional. So super important, again, no lighting, and also make sure it's a comfortable setup for everyone. So diving into a few tips for a good quality scan. What makes a good quality scan? So first things first is starting with a clean prep. So free of blood and saliva. You obviously, whatever retraction method you choose to utilize, we have a slide next that just shows the gold standard, what typically works best for iOS scanning. But you do want to make sure that, again, that prep is clean, free of blood and saliva, and dry when you are scanning. In order to do that, a few tips here. Again, these are just tips. If you certainly find that one thing works better for you than another, please, by all means, do whatever works best. Everybody has their own way of doing things, but as long as it falls in line with the recommendations and things like that. So in order to keep the prep clean and dry, you want to make sure you have cotton rolls, 2x2 gauze. You can use a hemostatic agent, air water syringe, and suction nearby. So again, you might not need all of these, but these are what we recommend. You may find that one works better than another. So certainly make sure you're using that method, but just make sure that prep is clean and dry. Another big thing with the iTero and some other scanners, this applies to as well, but you don't want to turn the wand on and off between segments. So I'll show you what I mean by this when we get to the live scanning. You really want to make sure that you complete a full pass. And what I mean by that is if we're scanning a prep, I want to start on the occlusal, I'm going to roll lingual, I'm going to roll buccal, and then I'm going to rock mesial distal. I don't want to turn the scanner off within that first pass. If I missed anything, I can go back in with a specific tool and capture anything that I missed. But I don't want to turn it off on and off during segments. I want to wait till I'm completely done scanning with the first pass. The next really important thing is making sure to sit the patient up to 45 degrees when capturing that bite. This is one of the other things that I often always find that offices do not sit that patient up in the chair. And, you know, it really does affect how they're biting in centric occlusion. You really want to make sure that that patient is sitting up when you go to capture the bite. And another thing is to, if you also want to take numbing into consideration as well when capturing the bite, because if you feel that patient is too numb to have a true bite, then you may need to take the bite before you prep. And there is a tool in the scanner to help you utilize and scan that bite before you prep or you numb. And again, make sure they're sitting up in the chair. All about the angles. So I always like this bullet point because if there's anybody on here that likes to take selfies, I know myself, if I'm taking a selfie, I want to make sure that I get a good angle, right? We're all about getting the good angles and making ourselves appear slimmer and all the wonderful things we want in a selfie. But think about this when you're actually scanning a prep, because as the user, you can manipulate the way that the prep is scanned. And what I mean by that is if you're not capturing accurate angles of the prep, you may be giving us inaccurate representation of that prep. I was trying to find the word and for some reason I couldn't find it. So bear with me, guys, but you'll see what I mean here when we go to the live scanning, because what I'm going to do is I'm going to show you, I'm going to scan the prep one way, and then I'm going to emphasize the angles in a next scan. I'll delete it out and then I'll just rescan it. And I want you guys to see the difference and I'll point it out to you. So as you're scanning preps, think about getting an accurate selfie of that prep. We don't want to distort the image. Here's another really important one. This one actually has been coming across my desk often, so I really wanted to make sure I highlighted it in this webinar today. If you are scanning anterior preps, please scan a full arch. Even if the patient has edentulous tissue. So if they're edentulous in the posterior and you only think you need to capture that anterior quadrant, please just try to capture the full arch with the edentulous tissue. Because if you guys remember early on in learning how to use the iTero scanner, if you cross the midline, the scanner is going to want or request a bite on both sides of that arch. Now, the scanner does throw you a curveball, and I have a slide right after this that's going to trick you quite a bit. But what's important is that you scan the full arch, make sure that you're not missing that edentulous tissue, and that way you can capture a bite on both sides if you were scanning any anterior preps where you would need to cross that midline. The next important is if there's anybody on here from utilizing a different platform, just please make sure that you know the proper digital workflow for the specific procedure. Some of the tips and tricks that I'm, offering here today, they do apply to other platforms, but some platforms have a very specific scan strategy workflow. So if you're on here from a different platform, just make sure that you know the proper workflow. And we can certainly help with some of the major platforms. So just let me know if there's anything I can provide. Here's the slide with the anterior prep. So again, this was important. This was a scan we actually got at our lab. As you can see, they only scanned an anterior quadrant. They obviously crossed this midline. So this is super important. If you cross that midline, I need a full arch and a bite on both sides. Don't just stop at the anterior quadrant, because again, sometimes it will orient the arches improperly. It's just best practice to go ahead and give us that full arch. Now, here's where the scanner throws a curveball. So these are not the same scans. This was just where I recognized this and the light bulb clicked. This is the scan after it was sent to the lab. So you can see all the teeth are highlighted in the tooth diagram. When you actually go to scan, I do have a laser pointer. Give me 1 second. Perfect. When you guys actually go to scan, the scanner is going to give you a recommended amount of teeth to scan based off of where you prep. So it's important that when you guys are going in to scan, see how it's only highlighted the anterior quadrant as a recommendation. Well, please just do not listen to this. Please just go ahead and do the full arch. It's going to be best practice, as I've been mentioning. So here's where it trips you. It gives you kind of a trick here. And then here's what it looks like when it gets to the lab. But again, just go ahead and do that full arch. So real quick, we'll cover the retraction prep style for quality scans. As I was mentioning in the earlier slide, the gold standard for iOS scanning is pack 2 cord, removing 1 before scanning. And then also just using a hemostatic agent to control any bleeding if that is not under control as you're packing cord. But it just helps with the visible margin. Again, if you're doing a chamfer prep, packing 2 cord really is going to turn out wonderful to the lab. We would prefer chamfer preps followed by shoulder. And then of course a bevel would be probably third most preferred in a iOS scan. But if you're doing this, your scan should be turning out wonderfully and your margins should be visible. So really quick, I'm not going to spend too much time on this slide right here, but your settings icon is really important in your scanner. Make sure that you have those guidance hints on. If it is unchecked, that means they are disabled. And we really want to make sure that if there's anybody that's new in the office, the guidance hints will walk them through a scan step for step. So it'll tell you exactly what it needs you to scan and what segment and which workflow. And it's just really important to keep those, keep that highlighted. And if you uncheck it, it will go away permanently. So you do want to make sure that if you need to put it back on, just go in the settings and check that box. The other thing is making sure that your prep order, your scanning order is correct. So when I'm talking about restorative prep order, I want to make sure it's set to prep first. And then when I'm talking about restorative jaw order, I want to make sure it's going to ask me to do the prep jaw first. Because if this is changed to the opposing, the workflow is going to be slightly different. And best practice is to have scan the prep first, prep arch, opposing, and the bite, which we'll get into here in just a second. So followed by the new RX for charting for a crown. This is obviously a brand new rollout. It came out in April of last year. I still think that offices, are adapting to it. They obviously made it a lot more detailed, more specific, which is beautiful for a lab, right? We want to make sure we have as much information from you as possible. The more information you guys can provide to us, honestly, the better outcome at the end of the day. Even if you give us too much information, it's never going to be too much from a lab perspective. So just, think about that. Anytime I train an office, I always tell them as much as you can give us, the better. So what you're going to do when you go to chart now is you'll go to select your crown. Now it's going to ask you for a specific specification, and which this is now what you see. So it's really important to make sure that if you're doing anything in the zirconia area, you're going to click full contour. Now, here is a little bit, the PFM, PFC, this is a little bit confusing from a user perspective and certainly from a lab perspective. I want to highlight this, and I'll highlight this when we get into the live scanning. PFM and PFC are two completely different product types. And so oftentimes what we find is offices will select PFM in the PFZ specification. When they get into the material, they will select EMAX, right? And at that point, you're asking for 3 different product types. So we need to make sure that it's very specific. And if you are utilizing any PFM or PFZ, you're selecting the right material. Because if not, the lab's going to have to put it on hold and we'll have to call you to clarify. So we don't want to slow down that process. We'll see this when we get into the scanning, so I'm not going to spend too much time here. I really want to make sure that I'm aware of the time frame here. We only got an hour. So once you go to chart for your restoration, here's all your options for any posterior teeth, and here are your options for any anterior teeth. So you guys are probably all familiar with this, but just want to make sure we highlight that. Again, another really important thing, and I've already gone over this, so I'm not going to touch on this again, but just make sure you pay attention to that tooth diagram. So that's going to tell you exactly what you charted for. If you selected a pretreatment, which will allow you to capture existing anatomy or take the bite before you numb the patient, it will tell you in the tooth diagram with a 1 and a 2. 1 is your pretreatment, 2 is your treated scan. So just make sure you're paying attention to this diagram. And again, this is just a recommendation, guys. So when it's highlighting these teeth, it's just saying, hey, you charted for for 1 single unit crown. We recommend you capture, X amount of teeth around that crown to get a good scan to the lab in a quadrant. You can scan the full arch if you choose, but again, just be mindful. If you cross that midline, you need a full arch. If you're doing implants, you need a pretreatment scan and a full arch. Like, they're just specific things we want to make sure we educate everyone on for just best practice and best workflow to the lab and with the lab. Oh, one other important thing on this slide, I'm going to jump back over here really quick. So this red box that I just highlighted, when you are going to actually scan, please make sure you do not click on the tooth diagram itself. You want to make sure you're utilizing these arrows at the right below your tooth diagram. This will help you not scan out of order, because iTero is a scanner in which if you start to scan out of order, you run into stitching and distortion problems. You want to make sure you scan what the scanner is asking you for in the right segment at the right time. I just highlighted on the scanning sequence for a single unit crown, but the first thing that scanner is going to ask you to scan is the prep. The second thing it's going to ask you for is that prepped arch, because that's how we have our settings set. The next it's going to ask you for is the opposing, and then it's going to ask you for that bite. So a single unit crown typically should be a pretty quick scan. If you add a pre-treatment scan, it's going to add a couple additional scan segments, but just make sure you're following what the scanner is asking you to do. When we get into the post-op of the scan, here are the tools that we are going to review. So just super quick, we're going to look at the margin marking tool, and I'm going to fill everyone in on this tool, the importance of it. I'm also going to walk you guys through the importance of deleting the margin out if you choose to not utilize that. So when we get there, I will make sure to highlight it, as well as the prep separation. So this is super important for the die. When we're scanning a prep, we want to make sure the prep has its own, section, and everything about that prep, the margin, everything is in line. So that way, when we ditch the die, we don't cut anything out. The occlusogram is going to basically tell you how much clearance you have based on the material you charted for. And your eraser tool is good if you need to do any adjustments on the prep. You can go back and physically adjust on the patient, come back in, erase it on your prep that you've already scanned, and just quickly fill in and rescan so you don't have to go back and do everything all over again. So great tool, but there are some specifics in here that are really important. If you don't utilize correctly, they will affect the way the scan appears when it gets to the lab. Okay, so here is where I am going to, bear with me, guys. I'm going to hop over to my scanner. Can everybody see my scanner? Alyssa, can you? I know they can't answer, but can you let me know?
Yep, we see your screen. Yep.
Okay, perfect. Thank you. So now I'm going to hop over into the scanner, guys, and we're going to actually walk through a scan together. So again, we're focusing on restorative. I will just make sure to hit on how to chart for a bridge, but the scan for a bridge is obviously the same as a scan for a single unit prep. So as long as you follow what the arrows are asking you to scan, you will be able to scan a bridge exactly the same way you will with a single unit crown. So I'm not going to dive into anything as far as the home screen. We're going to get right into a new RX. So, but really quick though, I do just want to highlight that new scan really should be for a new patient. Okay, if the patient's already existing in your practice, you can search them by the patients tab. and you can go, and just so you guys know, I'm in the demo mode, as you can see up at the top. So if you ever want to click on demo mode on your scanner and look at some, these were just like pre-populated. They're in every single scanner. These will show you some of the examples of things you can scan with your iTero. So everyone has access to this. This is just for demos only. You cannot scan a real patient in here and send it to the lab. So if you ever click in demo mode, just please make sure you exit out and get back into live scanning mode, because you cannot send to a lab from here. So super important. So I'm going to search my name. Here I am. So I've already been a patient. We've already done a scan before. So what I'm going to do is hit new scan right from that patient's chart. Now, if you accidentally click on new scan and you go to type in an existing patient's name, it will pop up down at the bottom in yellow and say, this patient's already existing. Do you want to just go ahead and load their chart information? And you should select yes, so you can eliminate any duplicates. So from here, what I'm going to do is my procedure type, we're doing fixed restorative today. As you can see, all the information about the patient populated. And if anybody wants to send me a birthday card, there's my birthday. Just kidding. But if you go ahead and select load that patient, or you select it from the patient chart, all their information will pop up here. And you don't have to, you want to put a chart number. If you had a chart number previously when you first loaded that patient, it will pop up here as well. But again, for today, we're selecting fixed restorative. Our due date. So again, just make sure your due date is within the laboratory's turnaround time. So we're just doing a single unit crown, and today is the 29th. So I'm going to give my lab about 2 weeks. So when we go into this send to, again, you can't here, it just says exocad. You know, these are just things that are populated in the demo mode section. So I'm just going to select clear smiles right now. We're not going to actually send the scan, guys, so don't worry about that. But as you can see, you cannot send it to a lab. So just really important to make sure you don't scan a patient in demo mode, because you will have to unfortunately rescan. Now, pre-treatment scan, here is where if I wanted to take a pre-op scan, the way I like to position this to offices is, you know, one situation was, do you want to capture that bite before you numb the patient? So obviously you can select pre-treatment if that's the case. Or if we're copying any sort of anatomy of the tooth before we prep it, or there's something you want the lab to be able to see before you prep that patient, a pre-treatment scan is great for that. So anything you want to show the lab before you prep or treat the patient, a pre-treatment scan will allow you an additional scan to do so. Now, there are some certain situations, if you're doing a crown fit to partial, things like that, you will need a pre-treatment scan. So just make sure, you know, try a scan with a pre-treatment scan if you've never used it before, and follow what the scanner is asking you to do. Now, for the essence of time today, I'm not going to do a pre-treatment scan because I am just doing a single unit posterior crown. So the prep on my model is number 3. Now, I don't know. Give me 1 second, guys. So as you guys can see, my tooth charting is obviously, this is difference with your tooth charting. So I'm just going to change it back to what we use here. Not sure why it won't change. Give me 1 second. I don't know if it'll update, but the tooth that I'm using, guys, is number 3. So I'm going to go over here to my chart, and I'm going to click on crown. And as I was mentioning earlier, so my specification is important for, you know, if again, you want to specify what category you're using, obviously, as far as material goes. So that's where the specification came in place. I'm selecting full contour because I'm doing a posterior molar. And from there, once I click in here, I'm going to click on my material. So what's important here is, now, if you use a specific material often, you can go in here and add favorites to your scanner. So you just click down on add favorite, and I'm going to favorite zirconia. And I'm also going to favor multi-layer. Maybe that's what I like, or translucent, right? So those are my top 3 that I typically use in my office. But for today, I'm doing zirconia. The body, obviously, you'll go into your shade, you'll select your shade system, you'll select the body of the shade. I'm just going to select a random one, again, just for training purposes, and then you can fill out some additional information. Now, again, the more information you give to us, the better. This is certainly doctor preference. And again, for today's purpose, I'm not going to go in and fill everything out, but you do have the option to select your prep design. I'll just do that one for today. And then you can select shade for incisal, gingival, and stump if you choose. Now, make sure you don't hit delete, because I know this is kind of tricky. Typically, you often close things by clicking down in the bottom right-hand corner, but you want to make sure you just hit this back arrow. Everything will save that we put in. And so basically what I have charted, and then I will make sure to put any notes. So please make beautiful crown. If there's anything specific that you want to put to the lab, or you want the lab to know, just make sure you put that down in the notes, and make sure, again, you're very specific, because we only see what you put on the RX. And so it's extremely important that if there's something you need us to know, you highlight that on this script. Everything is filled out as far as for a single unit crown. Now, if I wanted to do a bridge, I'm just going to select anything random here, and I'll delete it, show you guys how to delete that out. I'll select the tooth I'm starting with. So I'm going to go 22 to 24, right? And so now you see it will populate my span of my bridge. Now I'm going to go in and I'm going to select abutment. This is my Pontic and abutment, followed by the specification. So same concept as charting for a single unit crown, by going in and selecting all of your material and your shade and any additional information you want to give to that lab. So charting for bridge, you just want to make sure that you're selecting your abutments and your Pontics, and that's clear to the lab. And if I hit the back button, you can see that it's charted. If I want to delete this out, I will just click back on here, and I'm going to hit delete. And now it's gone. So moving along to scan the single unit crown. I want to make sure that I have a clean sleeve and that the sleeve is pushed all the way down on the scanner, so you hear it click. Now, you don't want to push too hard, but you do want to make sure that that sleeve is all the way down to the base of the wand. Otherwise, if you've ever seen a white line above your viewfinder in the left-hand corner, it's because the scanner sleeve is not pushed down all the way. And I hope this scanner is not going to give me any issues. It was running a little loud earlier, so please just bear with me if it does. So first things first, as you guys can see, the scanner is going to want me to start with tooth number 3. And I don't know why I'm going to have to restart the scanner. Sometimes you just have to give it a reboot, because as you guys can see, it was in a different charting there in the RX, but now it's actually telling me tooth number 3 here on the tooth diagram. So I'll just make sure you give if your scanner is ever acting weird, just give it a sync configuration. It won't do it because I'm actively scanning. But once I get done with the webinar today, I'm going to hit sync configuration. I mean, this is a piece of technology. It oftentimes, needs to reboot itself or just have like a refresher. So that's always a great way. And if you ever add a lab to the scanner, you can hit sync configuration.
Thanks, Tori. When in doubt, reboot, right?
In doubt, reboot, guys. That's always, I saw a meme that was, it was like, someone was calling into their IT department, and the first thing the IT department said was, "Did you restart it?" And it's like, well, yes, that's the first thing we typically always do. But yes, when in doubt, reboot. Once the scanner comes back up, hit sync configuration and see if that will help. Obviously, I'm just scanning a Typodont, but I do want to highlight to you guys, do you see the smudges on the viewfinder down here in the left-hand corner? You do want to make sure that you have no smudges on your scanner screen. I typically just reuse this one because it's for a Typodont, but I probably need to clean it or retire it at some point in time. So make sure when you're scanning patients that this is not smudgy. If you just put the lens on, you can take a cotton roll and you can wet one side of the cotton roll if you don't have that lens cleaner right near you. clean the sleeve, the lens of the sleeve. And then on the other side, keep it dry so you can just dry the screen really quick. That will help as well with the smudges, but that's important. So just make sure when you're scanning a patient, that is not the case. Now, the first thing the scanner is going to ask me to scan is my prep tooth. As you guys can see, I've got my green crosshairs, so I'm trying to center that in the middle of my prep. These green crosshairs actually correlate with the prep separation tool to help me position my die correctly. So you've got the green crosshairs. Once I scan, you will also see the green dot. So we ideally have 3 chances to ensure that our prep separation tool or our prep separation is correct before we send the scan to the lab. Now, my prep is clean and dry. I'm going to try to center my green crosshairs as best as I can. Now, I will tell you, it's not that big of a deal if you don't have them too centered. But once I start my scanner, guys, I'm going to let it hold for a second, and I'm going to do occlusal. Remember, I'm showing you guys one thing really quick that I want to point out. So see how fast I'm scanning? Occlusal, lingual, and then I'm rocking mesial and distal here. I'm going to cut my scan. As you guys can see here, there is some artifacts over here, but I wanted to show you guys really quick because I'm going to guys the right way. So once you saw the additional artifacts come into place, but did you guys see how I rocked occlusal, lingual, buccal, but I captured it and it's all here. And just imagine if this wasn't a typodont, right? Because we can clearly see the margin on the typodont. But as you can see, I didn't roll very lingual and I didn't roll very buccal, but I did get the information. Everything's here on the scan. I'm not missing anything. It looks good. Now, we could send this to the lab and it would probably be okay. But what I want you guys to really focus on, I'm going to delete this segment here, is I want you to focus on the angles again. So I'm going to center my crosshairs with this prep as best as I can. So I'm on the occlusal, let it hold. I'm going to roll very lingual. See the margin line, the margin color change? Now I'm going to roll very buccal, which is horizontal on my prep. See that color change? I'm going to come back up to the occlusal, rock mesial, and distal. Now, do you see the difference in the lighting and the difference in what you can see on the prep as it stands currently? The other prep looked fine. We looked like we captured it and it was good. Thing is much more crisp and clear. And as I was rolling lingual and I was rolling buccal, you could see the lighting change on the area it was capturing. That's what you want to see when you're scanning your preps. Try to roll as lingual, which is a vertical motion, and try to roll as buccal, which is a horizontal motion with the scanner. So I'm going to move along. I'm going to place the green dot in the center of my prep. Now, as you guys notice, I did rock mesial distal here, but I'm not worried about the contacts at this time. I am only worried about my prep, the margin, and there's no missing data on my prep itself, right? So now I'm going to move to the prepped arch. And again, I am going to follow the tooth diagram and the recommendations here because it's just a single unit prep. If I was scanning in the anterior, I would do a full arch. My scanner, give it a second to recognize where it is in the mouth. I'm going to do occlusal, dip into my lingual, which is a vertical motion. I'm going to roll out to my buccal slowly as it has not seen this surface quite yet. And a little bit more gentle for the bite. And then I'm going, I did one pass. I did occlusal, lingual, buccal. So I'm going to come out of the mouth and assess what I have currently. Now, the prepped arch is extremely important because here's where I need you to capture any contact data. Because as you could see in the scan before, I was only concerned about the prep. We take that single prep, we ditch that die, and we remove we place that single prep into this arch to ensure the contacts and everything fit. So if you've ever had any contact issue and it's consistent, try to think back to how you're scanning your arches, because you may be missing it here, or contact data may be missing in this prepped arch, and here's where the lab uses the contact data in this prepped arch. So super important. Now, I missed some on that distal molar. What I'm going to do is hold my finger down on the screen and activate my fill tool. My fill tool is going to circle what I missed. So it should circle that whole uh-oh, guys, am I freezing a little bit?
You're good. You're fine, Roy. When you have a second, we do have a question in the chat.
Okay.
When it's a good point. Do you want me to read it to you?
Let me do this really quick because
Okay.
Off. Okay, I can go ahead and answer it because it'll turn off if you wait too long. But I'll go ahead and answer it and see it. So how do you capture the hard area to reach, like distal of number 2 or 15 with patient so sometimes what you'll have to do is try to capture what you can in the first pass, and then you need to activate this fill tool. So this fill tool will kind of help you go in at any angle in the mouth. It's hard to sometimes do. So like if it's really like if the patient is opening like this and you're trying to capture any of those distal molars, sometimes you have to have the patient kind of work with the wand and kind of open and close their mouth a little bit as you're scanning those distal molars. Now, not open and close, but just kind of move around a little bit. Now you can turn certain ways. If you can't capture it in the first pass, again, utilizing this fill tool will let you go in the mouth at different angles to try to pick it up if you couldn't capture it in your first pass. I oftentimes see offices that they'll try to capture it like, so if you're having a hard time capturing it, you know, sometimes I'll see them where they're just continuing to try. And so at that point, saliva is coming into play, might be uncomfortable for the patient. So just come out the mouth, cut the scanner off, evaluate what you currently have, and then utilize that fill tool to go back in and fill in anything that was missed. So hopefully that'll help. And if it doesn't, if you want to contact me after, we can work on some more of like the angles and things like that if need be. So hopefully that was helpful.
Thanks, Tori.
You're welcome. So sometimes the iTero will help like fill in information. As you guys can see, there was a much larger area that I was missing. Now, I'm not so much worried about the spot up here at the start of my quadrant because that's not going to come in contact with my prep. I'm worried about my contact data. So now I'm coming in the mouth, kind of at towards that spot that I'm looking to capture. So again, it's the fill tool will help you come in the mouth at a different angle than what you typically would to do an occlusal lingual buccal pass. So that's why the fill tool is helpful. So I've got my information filled in, and everything looks good. What I'm really looking for here is lit occlusal surface, enough gingival to capture my bite. And of course, major thing here is contact data adjacent to my prep tooth. And I know I'm clicking this with my finger because my computer is touchscreen, so I'm sorry if I did that earlier. I'm flipping through my segments with my tooth diagram. So I want to make sure that I'm not using, or I'm sorry, with my arrows, I'm not using my tooth diagram. Getting ahead of myself here. All right, so now I'm going to the opposing, which is same occlusal lingual buccal on this quadrant. So I'm gonna let my scanner hold for a second. Just doing a quick pass. What I'm really focused on here, again, is enough gingival and a solid occlusal surface. A pretty quick scan for most of you. Obviously, you know, you'll come into contact, not everybody has a full set of teeth, right? So the biggest thing I think is the edentulous space in those edentulous areas. If you're scanning where the patient does have some dentition, and then you come up, you're doing your pass and you come up across an area where they've got edentulous tissue, oftentimes what will help is to kind of do like a roll over the arch as you're doing your occlusal pass. If that doesn't tend to work, try to roll to the buccal bony ridge and follow it along the edentulous stretch and roll back up to the occlusal of the next closest tooth. Then you'll have to, then you'll have to do some stitching because you'll come back in on the lingual and you'll want to do a bit of the same thing to kind of stitch that occlusal surface. That does tend to help a little bit. And then of course, just making sure that edentulous area is dry, because if the scanner is reflecting off of any saliva, it will make your life challenging. And again, if there's any other lighting present, that will affect it as well too. So just make sure it's as dry as possible. And if you're actively scanning, you can keep a little 2x2 next to you just to try and use, to dab the area just to keep it as dry as you possibly can. I know that doesn't happen for every patient, but the best you can do, the better the scan will be. I do see another question. Is there such thing as scanning too fast? Yes. So I start my scanner. Do you guys notice how I let my scanner hold for a second? I wanted to recognize where it is in the mouth, because a lot of times what happens, especially if you have any edentulous tissue, you're always going to need a reference. If the scanner loses you, you're going to need to reference a spot that it has already picked up. So when you start that wand, let the scanner recognize where it is. And don't start the scanner, because this is a contact scanner, meaning you want contact flat on the tooth. When I start my wand, I don't want to start it like up here, right? Because I'm not in contact with the tooth. I don't want to start until I'm in place, touching the tooth, in position, ready to scan. And when I start my scanner, I give it just a second to recognize, because again, it's a piece of technology and it's capturing thousands of images per second. And specifically when you're scanning the prep, it's capturing 6,000 images per second. Think about that per second. So if you're going too fast, you may have some distortion, you may have some stitching problems, but then that kind of pulls into play. You don't want to scan for too long. So let me just explain that really quickly, because I want to make sure that everyone understands kind of the idea of over scanning. So when I talk about over scanning, I could probably scan this typodont. I could sit on this tooth and scan this typodont because nothing's changing about my typodont. Now, if I sat here for hours and scanned the same typodont, obviously we'd have some issues. But when you're scanning patients, if their environment is changing, you are now over scanning. Because think about the first image you captured is clean data, hopefully, right? And if especially on that prep tooth, you really only want to spend 8 to 10 seconds scanning, and then use your fill tool to fill in anything you missed. Because if you're just sitting on that prep, scanning, blood's creeping in, saliva, things are changing about that patient's environment. And so now you've got good images compiled with dirty images, and the scanner is doing its best to stitch the most accurate one. So you also want to be aware of how slow you scan. Now, edentulous scanning, you have to be a little bit more patient with yourself and the scanner, because you are going to scan slower than your normal speed. I know that was a long way of answering it, but that was a really great question, because it brought up a few things I think I wanted to highlight. So I appreciate that question. Hopefully that helped. Okay, so now I'm going to move along to my bite. And what's important here is, again, I'm going to sit my patient up. The one thing I want to just highlight is you don't have to go so far posterior when you take this patient's bite. You could really take, it doesn't have to be over that prep either. You could take the bite and the premolar area, which the prep is kind of in my premolar area. I don't want to go too far past the canines. And of course, I don't want to cross that midline over here, because I'm not scanning a full arch. So make sure that when you go to take the bite, you sit your patient up in the chair. Same concept when I talk about letting the scanner hold for a second. When I start my scanner, I'm going to hold for 1 banana. I know that sounds funky. You don't have to say it out loud. You can say it in your head. I learned that in training myself, and it has helped me tremendously just to slow down a bit. So I've got my scanner in place, on and hold for 1 banana. Now I'm going to go up 1 tooth tissue, down 1 tooth and tissue, and really quick. If you ever have a problem with the bite popping in, it could be because you are scanning too fast, because when you were trained, you were probably trained to do a zigzag motion. That is still true, but as you guys could see, I let it hold for a second, and because I captured enough gingival on both sides, it was able to quickly pop that in. If the scanner is not allowing you to capture the bite, it could be you're moving too fast, you're zigzagging, you didn't capture enough, gum tissue, couple of different, maybe the patient's not sitting up, so it's not recognizing their true bite. So a couple things. So best practice is sit the patient up in the chair. When you start your wand, hold for one banana, just say it, one banana in your head, go up one tooth and tissue, down one tooth and tissue. If you need to go a little bit further, do the same motion, up one tooth tissue, down one tooth and tissue, and it should pop in relatively quickly. And this is accurate. My posterior molars are not occluding in the back of my typodont. So I always typically tell offices, check the patient as well as you're looking. You can have the patient bite down, just find some contact points and reference the scan before you send it. In a situation where the patient does have a different class bite, just make sure you just put that in the notes, because that does help us. Sometimes we want to make sure we verify the bite on our end. And if you go ahead and let us know that there's a situation, it will also help us on the production side as well. So that's it with my scanning. I think I might see another question. Hold on one second. Oh, that might be it. Okay. Answer it live. So I answered it live. Okay. New to this, guys. Zoom is much different than Teams. Okay, so what we're going to do here is we've now finished the scan of our crown. Again, best practice, I didn't use my tooth diagram while scanning. I followed the arrows so that I scanned in order. You can choose to scan in color or in monochrome. Now, I'm going to show you guys what's important when we get into post-processing in monochrome. Hopefully this was something that everybody was trained on in the early beginning, but when you go to look at your prep and your margins, make sure that you're looking at it in monochrome versus color. Monochrome is going to give you a more accurate, it's going to give you just more accurate definition and allow you to see that margin line better. So take a look at it in stone and monochrome, or monochrome, which is your stone model. And just verify that you can see everything on that end. Now, what this occlusogram correlates to is obviously, as you can see over here to the side, that we've got our occlusal clearance. And the occlusal clearance is already, the scale is basically already determined for you based off of the material you charted for. So you do not need to scale this. You do not need to change it. It's taken into consideration. So I charted for a zirconia, plain zirconia crown. It's taken into consideration how much clearance I would have based on that material thickness and type. Now I want to look at it obviously and just make sure, I don't know why it came in upside down. Just make sure that again, I have enough clearance for my, restoration. If I did not have enough clearance, then that's when I would use my eraser tool. So one thing that is, don't do that. This always trips me up. You have to engage and disengage your arrows over here. So sorry about that. The one thing you really want to make sure you do is make sure that you are on your, okay, now it's going to let me, make sure that you are on the prep tooth and not the prepped arch. Because remember, we use the prep tooth to fabricate. We do not use the prep that's in the prepped arch. So it's really, really important that, like, if there's anything you take from today, it's this. I'm just going to erase that really quick and just re-show you guys. So if I was actually clicked on the arch, and I clicked here, do you see how that tooth is grayed out? Do you see how it's telling me, this is trying to signify to you as the clinician, hey, you're going to make changes to the wrong prep. You want to make sure you're on the right prep segment, because that's the first thing you scanned and that's the prep that the lab uses. So if you make any eraser marks on this prep, we don't get it at the lab. So super, 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 super important that you click on the prep itself. You can turn it back into color if you choose, however you choose to work. Again, I just did it again. You want to make sure that your model is turned on its side, because the eraser tool typically is to erase any sort of occlusion, right, on the top. We're not trying to erase our margin because we verified that our margins are good. So we don't want to touch anything with the margin. As long as you roll it on its side, what you're going to do now is lock it in. And then you're going to use your finger or a stylus pen, something to help you draw an accurate line. And I'm just going to draw like a semicircle and close it at the top of my prep. So now when I go to turn my prep, notice how I don't cut into any of my margin. I'm only erasing the top of that prep. And so then what the scanner is going to ask me to do is just quickly go back in and scan it. And for the sake of time, I'm not going to do it, but what you would do is just click right on this scanner screen and it will take you right back to the scanner screen. All you have to do is sit on the occlusion of the tooth and just kind of rock a little bit and it will fill in because you've already captured that buccal and lingual margin. So you don't need to do the whole angle thing again. But this is obviously after you go and physically reduce the prep on the patient. You want to come in here and cut off what you reduced on the scan. So I'm just going to hit that, go back to what I originally was working with just for the sake of time. And because I'm in demo mode, I didn't really realize this, guys. I'm so sorry. It's not going to allow me to do the margin marking tool with you guys. But the one thing that's super important about the margin marking tool, if you click on it and you don't want to send that margin to the lab, there's a little red X that pops up off to the side. Or you can hit the refresh arrow and it will remove anything you previously did. You have to make sure you exit out of that. Otherwise, the lab will get that margin. So if you just hit, like, for instance, it looks the same like this when you click on it. So if I hit just the red minimize button, that margin that auto-populated when I clicked on that button will save. So the lab actually ends up getting that. And then we have to call and verify, is that what you wanted? Did you mean to do that? Did you want to mark your margins? If you choose to mark your margins, let us know in the notes. Doctor marked margins. That tells us, that skips a step, and that tells us that you've already verified that margin and that's what you want to proceed with. So I'm sorry it's not showing up here in demo mode. See another question. Why did the occlusal in number 2 show red when there was no occlusion? Let me take a look at that. That's a good question. I actually didn't even catch that. So I don't know if it's because, I don't know if it's, so here's the thing. Like if the patient was, like obviously this is a typodont, there could have been a time where, like, if I push my typodont down really hard, and because it's got these ridges right here, it's kind of hard for me to, like, and it's hard and it doesn't move, right? So when I go to move the scanner up and down to get an accurate bite, when I push on it really hard, it actually does touch. So that could have been, and that's a really good thing to look at, though, because again, if you know your patient doesn't occlude in the back, then something might be off, right? Or the patient open and closed, or you push back too far. So it could just be because as I was scanning, I might have opened it a little bit. But when I push down on it really hard, right, they do touch. So it could have just been contact with the way I pushed on it. But I'm going to ask iTero, because that is interesting that it's got a lot of heat mapping on it when really it doesn't. There is no occlusion when the typodont's just sitting freely closed. So good question. What I'll do is, I see your name. If we can get an email or something, I'll follow up with an answer to that question.
And Tori, we can add that. If you get that information to me, I can just email it to the group.
Okay.
Because
perfect.
Probably more than one person might have that same question. So once we find that out, I'll send out a follow-up email with that.
Awesome. Yes. Great question. Thank you so much. Yes. Sometimes, guys, with the technology, sometimes it's always changing and it's always evolving. And, sometimes there's certain things like the education is always obviously the most important thing, because just as you guys can see, there's small things that affect the lab. There's small things the scanner does that will affect the production, at the end of the day. So I'll ask iTero just to see if there's some, real explanation there. But I just kind of think it might have been the way I was pushing down on the typodont while I was scanning. It may have had some contact at some point. So you do want to make sure that the patient is not opening and closing as you scan. And what tends to make them do that is if you do push too far back in the posterior, because it gets uncomfortable. So great question. Thank you so much. Okay, so we're almost done here, guys. I know we're hitting the top of the hour. We didn't even get to see the scans. Prep separation really quick is just making sure, you wanna make sure you engage the arch, but make sure that all of the margin in the prep tooth is within its own segment. I could probably add a little bit to this area. So what I'm gonna do, actually I need to blow it up before. So see how it's cut off just a little bit right next to this adjacent tooth. This is a little time consuming, I will be honest, but it does save you so much time from a lab perspective, because if anything's cut off when it gets to us, we may have to send it to iTero modeling and have them fill it in. We do want to make sure it's not like way over in the adjacent tooth, especially if you're doing multiple preps. You do really want to make sure if you're doing multiple preps, this is huge from a lab perspective. Make sure that your preps have their own prep separation to avoid having to send it to iTero modeling, because when we go to cut this out, this is what will be cut out when we go to ditch this dye. Okay. And just so as you can see, this is also just an indicator of what I was talking about earlier. I know it's showing you the whole prepped arch, but that's because, again, see how it's just the prep that's highlighted in the tooth segment over here, tooth diagram. It's showing you that what we're using is the single prep you scanned in the very beginning of your scan segment. We're not using the prep in the prepped arch. It's the first one you scanned. And then we place it into that arch and double check everything. So just make sure everything lines up, looks good. If it looks good, then you'll hit this mail button, sends it right off to the lab. So I'm going to just exit out of, just run through the PowerPoint. So I know we're at the top of the hour. If you guys need to hop, certainly understand, but I do want to pull up the PowerPoint to show some of the scans that we have received here at Lexier. And I do have another webinar today, so maybe I'll try to run through it faster, but you guys had some really good questions. So here is a perfect scan that we received here at the lab. You can obviously see, this is why we do stone versus color. You can see the margin all the way around. Now, we do not grade your prep style. We do not grade how you prep. All we're looking for is, can we see the margins so we can fabricate your crown? So I know some scans, I've shown some of these before, and I had some doctors say, well, you know, what about the prep itself? We don't grade that, right? We're not here to tell you how to practice. We're just here to help you ensure you get the best restorations. Here's another perfect scan. Again, you can see the margin all the way around. It's clean, it's clear, no blood, no contamination, anything getting in the way of us fabricating a crown. Here we're getting into good scan. You guys can see over on this buccal margin, we do have some tissue covering that margin. So again, we dropped it down a category, but otherwise pretty good scan. Forgot I got some animations on here too, so let me remember. So now we're looking at, again, another good scan. So some tissue covering the lingual margin, not as bad. Some on the buccal margin as well too on this other prep, but so it appears like that when you look at it in color. When you go to look at it in chrome, you can see the margin. So again, that's why it's so important to double check both. Now we're getting into the manageable scan. You can start to see how the margins slightly disappear. We start to get some distortion. We start to get some blood, not as much saliva. I mean, they did, it looks like it's pretty clean, but sometimes you don't know, because if the scan looks fuzzy and distorted, that could be an issue of not a clean sleeve or saliva creeping in, things like that. So you do just want to make sure when you go to scan that prep, everything is crystal clear and clean and free of blood and saliva. And yes, over on that side, we can not really see much of that margin. Again, another manageable scan. Really don't have much to work with here over on this lingual side. So just super important that you can see it, because if you can see it, we can see it. If you cannot see it, chances are we cannot see it. Now we're getting into rescan required, and obviously you guys can see why. If you ever see this situation happening when you look at it in the monochrome, monochrome is really good for showing you too any saliva bubbles or things like that. Now it doesn't pick up on so much of the blood, but when you look at it in color, we can see this is saliva creeping down here. And so like it will show you kind of like a pixelated fuzzy image. And again, we really cannot work, with a prep that is just covered, the margins covered completely in blood tissue, a lot kind of going on here. So, this is why we show these, just for education. And I think it's just important, again, to know the ways to look at your prep and know, the specific retraction methods and things like that to help you as you are adopting this technology. Okay, and this one, I don't really know what happened here. My instinct is telling me that they were spending way too much time scanning this prep, and again, didn't have a clear sleeve. They were probably just sitting over that prep, just almost hovering for entirely too long. And I think this is a situation of compiling clean data over top of super dirty data. And this is what we received at the lab. And again, there's just no way we can proceed with that and send you a beautiful restoration that you're looking for your patient. Again, another rescan required. Multiple, assuming they're, but again, distorted, unclear margins, kind of a lot going on. So again, just when you're checking everything before you send it. Couple last things. I still do see we have 5 attendees in here. So if there's ever an opportunity that we can come in and support, we would love to do hands-on training. We could do a webinar style training like we're doing today, or encourage, employees to attend the webinars that we put on once a month. Or, again, we have trainers, around the country. And if there's anything we can do to come in and help support, certainly just let us know. Or if you're interested in having your whole office or maybe multiple offices, if you're part of a group, we can look into doing things like that as well. But we're here to help you. This is a journey, so please don't feel like you're doing it alone. If there's anything we can do to support, let us know. Connecting your iOS to Elixir Lab. So if we have folks here from iTero, you can take a snapshot of this if you would like, but these are all the iTero codes to connect to any of our Elixir labs. Or you can visit the website, select send a case, and it will then show you how to submit from any other digital platform if that's what you currently have other than an iTero. It's just a little short video. I won't take too much time because I think we've still got 4 people hanging on here. Thank you guys so much. Here, if you want to take a screenshot of this, we can also drop it in the email to you guys as well. But this is just your iTero resources. And so technical support, you're going to want to need that line. If you're doing Invisalign, that's who you'd call as well for Invisalign support. MyITero.com is to access anything remotely. So that is a cloud storage base that obviously is, same as your scanner. You just can't scan and send cases from MyLab Connect, or I'm sorry, from myitero.com. LearnITeroElement.com, just endless resources, things that will help you with things we discussed today, workflows, PDFs, live webinars from iTero. So just a great resource to have. Okay, I see some, thank you. Okay, perfect. Someone has to run. And then, okay, perfect. Thanks, Alyssa. I just didn't know if anybody else had a question before they hopped off. And then this is just our contact info. Again, we'll send this out to you so you don't have to do anything here. We'll make sure you get it. But for those of you that are still left hanging on, we do have a survey, which we'll also send in the email as well too. But we'd certainly appreciate if you would just go in, take a short survey on how we did today. And if there's anything else we can help you with, we will be doing these webinars monthly. So next month is implants. The following month will be removable. So we'll try to cover a different topic each month. But if you need something in the meantime, again, you just call us and we're happy to help anytime that we can. So hopefully today was helpfully you'll join our next month.
Thank you
So
so much, Tori. There was a lot of information. Very,
a
very
lot.
helpful. For those that are still on, we will definitely be sending out my information and Tori's if you guys have follow-up questions. And we do hope that you can join us for the future sessions. Thanks,
Awesome.
Tori.
Thanks,
Have a
everyone.
great
Enjoy your day.
afternoon. Thanks. Bye.